Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
One of the main tools the Centers for Disease Control and Prevention has to help it control and prevent is the National Healthcare Safety Network. As the nation's most widely used healthcare-associated infection tracking system, it ensures the folks whose job it is to help patients are being protected themselves. For an overview of how the NHSN works and the role it plays in CDC's mission, we welcome Arjun Srinivasan, Deputy Director for Program Improvement in the Division of Healthcare Quality Promotion at the CDC. Mr. Srinivasan, thank you so much for joining us.
Eric, thank you so much for having me on.
Of course. So let's just start with the National Healthcare Safety Network. Give us a little background on it and when it was started, if you can, and how it actually works.
Yeah. The National Healthcare Safety Network, foundation of this network is actually incredibly long-standing. So the CDC has had a system to monitor and track infections that occur while people are getting healthcare going back way back into the 70s and early 80s. So the foundation of this system is unbelievably strong. It's a very well-established system. The current kind of modern web-based iteration of the National Healthcare Safety Network itself dates back to about 2006. So it's a really, really well-established, long-standing system that has grown dramatically over the years. When it began, it was really kind of a voluntary system. About 300 hospitals from around the country who volunteered to track these infections in order to give us benchmarks, right? To help other hospitals know, okay, if I have 6 infections, how does that compare nationally? So it grew from that voluntary 300 hospitals way back in the 80s. And now NHSN has expanded not just to include literally every acute care hospital in the country, but also includes every dialysis facility, every nursing home, every ambulatory surgical center. So Eric, there are more than 38,000 healthcare facilities in the country that currently report their data into the National Healthcare Safety Network. Some of that reporting continues to be voluntary, but a lot of that reporting now is mandatory. And so this has been a wonderful growth of the National Healthcare Safety Network, as you were pointing out. It's a system that is used by so many people. And one of the big users is the Centers for Medicare and Medicaid Services. And so, many years ago, when they became interested in tracking healthcare-associated infections and beginning to use that information for some of their quality reporting programs, we collaborated with them. We said, hey, you don't need to create another system for this. We have one. And so there is a lot of that reporting that is now mandated by CMS. So it's a really long-standing and stable system. A little bit on how it works. You said it is a web-based system, so people can enter data into the system. But one of the things, and we can talk a little bit more about this in the interview, because I think it is incredibly exciting, that is it increasingly moving towards a fully automated and electronic system where the reporting, nobody has to enter any data anymore. Rather, the data is coming straight out of electronic health records and into the system. And that is the future state that we're aiming towards with the National Healthcare Safety Network. So it's a time of exciting transition and growth and change for NHSN.
Yeah, we'll get into the reporting mechanism shortly here, but I do want to just break down the overall use that CDC has for this kind of information. You get infection numbers from a certain healthcare facility or a certain area. What does the CDC's policymakers and and folks that track this stuff do with that information? Yeah,
it's used by a host of different users. And so that is one of the beauties of the National Healthcare Safety Network. It doesn't serve just one purpose. So we at CDC use the information to track national trends, to track state trends, to allow states to see where they stand with respect to other states. We use it to inform our programs. We have funded programs in every state and many large cities. These are folks that are specifically tasked with helping the facilities in their states reduce these types of infections. So they are looking at that information on a regular basis to say, is there a hospital out there or a nursing home that's seeing an unusually large number of infections? And if so, let's give them a call. Let's find out what's going on there. How can we help that facility? What can we do to support them? As we discussed, it's used by the Centers for Medicare and Medicaid Services in some of their quality and reporting and payment programs. But it's also, and I think perhaps most importantly, it's used by the facilities themselves. They're actually perhaps the most important users of this information because they are the ones who are really taking the action to prevent these infections and these other types of adverse events. And so the beauty of NHSN is that everybody has access to the same information at the same time. So when the data goes in, we can see it here in the government, but the states can see it, the facilities can see it, and everybody has that same visibility and can then look at that information and say, well, why are infections going up in this particular area? Is there something going on? Why are infections going down? Is there something that we could learn from this state that's seen a larger reduction, or this facility that's seen a larger reduction than these other types of facilities? So it has, so many different purposes. And I think anytime you have so many different smart people looking at the same information with slightly different perspectives, it's only to the benefit of everybody involved. It's also information that's publicly available. So CMS posts the NHSN data at the facility level on some of their quality reporting websites. And so the public has access to some of this information, and it allows them to be informed consumers of their healthcare. We tell people, if you see high infection rates at the hospital where you're going, that's a question that you might want to ask. What are you doing to keep me safe and protect me from infection? So it's powerful information in the hands of a whole host of people who can really use it to make a difference.
We're speaking with Arjun Srinivasan. He is the Deputy Director for Program Improvement in the Division of Healthcare Quality Promotion at the Centers for Disease Control and Prevention. So, let's get into a bit of the tech behind the NHSN. You mentioned it is a web-based mandated reporting mechanism. How does it work, and what is the kind of new technology that you had mentioned going behind us as far as artificial intelligence and using other methods? And a big contract was just awarded to Leidos for a modernization of the program itself. What can you tell me about the future of NHSN?
Yeah, we're particularly excited about where NHSN is going, and it's this tremendous leadership from the team that runs NHSN. They are really working to try and see into the future and try to anticipate, where do we need this program to be? And we recognize that, gone are the days, or should be gone are the days, where people had to, manually go to a website and enter data into a system. We know that the information to do all of this reporting sits in electronic health records. And so we are increasingly working towards automated systems where the data that's required or needed for the reporting comes straight out of the electronic health record and straight into the National Healthcare Safety Network, so that people don't have to do the entry. They can simply open up the application and see the data that's been reported. They can check it to make sure that it's correct, but they don't have to do the entry. And we've already entered that future state with some of the different types of reporting within the National Healthcare Safety Network. Perhaps the best example is facilities are now required to report information on antibiotic use and antibiotic resistance into CDC. We think this is vitally important information to help us protect people from these infections that don't respond properly to antibiotics. That reporting, there is no manual option for that. That reporting must be done electronically. So it comes straight out of the electronic health record from the pharmacy systems, from the bed systems, and all that information comes straight in to the application, and then users can get back not only their rates of antibiotic use and resistance, but they also get, as we discussed, these important comparators of how does your antibiotic use compare to someone else's antibiotic use. And that is where we are going, right? So we envision a future where measures are what they call these digital or electronic quality measures, where the information